Welcome to the Unity Healthcare Open Enrollment Benefits YouTube channel. This presentation will cover health savings and health reimbursement accounts. These presentations are facilitated by your HR benefits team. My name is Michelle Otley. Let's get started. Health savings account. A lot of folks get confused about HSAs and FSAs and HRAs. It's truly a ton of acronyms to try to remember. Let's watch a brief video on health savings accounts to try to clarify exactly what an HSA is.
A health savings account, or HSA, is a bank account that you use to pay for healthcare expenses. An HSA is different than other bank accounts because the money you contribute, use on qualified expenses, and save over time is not taxed. We call this the triple tax advantage that no other bank account offers. In order to open an HSA, you must have a qualified high-deductible health insurance plan. You can use your HSA money to pay for eligible healthcare expenses for you, your spouse, and your children, even if they are not covered by your health insurance plan. The HSA lets you take charge of your health care. You own 100% of the money in your HSA, not your employer, the insurance company, or anyone else. Plus, the money remaining in your HSA rolls over from year to year. You also decide how much money to put in your HSA, and you control how the money is spent. You can use the money in your HSA to pay for everyday healthcare expenses, such as doctor visits, prescriptions, or dental and vision copays. You can also save and invest the money in your HSA for future healthcare expenses, or even retirement. All of these tax savings from the HSA can translate into significant discounts on your healthcare expenses. This is why an HSA helps you get more value for every healthcare dollar you spend. Flex is here to help you understand how to save and spend healthy.
So HSAs allow you and your employer to put aside tax-free money to help you pay for medical, dental, and vision expenses. Now, with that being said, in order to have an HSA, you must be in a high deductible health plan. So you must be in the Care First point of service or the new Care First Smart Selection plan. Health reimbursement accounts. Kind of similar, but a little different. Let's look at that.
All of us could use a little extra help when it comes to paying for our healthcare expenses. A health reimbursement account, or HRA, is an employee benefit that really fits the bill. An HRA is a special account your employer sets up for you to cover your healthcare expenses. Only your employer credits money to the account. You never contribute a dime. As a bonus, this money doesn't count toward your income, so you don't pay taxes on it as long as it goes to pay qualified health expenses. Every dollar goes a little further than if you paid out of pocket. What can you pay for with an HRA? Well, employers decide what can be paid, since they're the ones who put in the money. But usually, HRAs can be used to pay out-of-pocket expenses that aren't covered by your health plan, like copays at the doctor's office, or your deductible, which is the amount you're responsible to pay each year before your health plan starts paying. The rules can be different for each company, so check your benefit materials to see what rules apply to you. If you want to see how much is in the HRA, just go to the member website. You can see how much your employer made available to you, check the current balance, and see what claims have been paid. Most likely, you'll have to use contributions to your account the same year they are credited. Check your benefit materials for the rules that apply to you. So how do you use the HRA to pay for health expenses? Actually, most HRAs are set up so that medical claims get submitted to the account automatically. This way, payments go straight to the healthcare provider. In some cases, you may be able to submit medical claims online and simply push a Pay Now button. A few HRAs even include a debit card you can use to swipe when you receive services. All in all, an HRA is a great way to help cover your healthcare expenses and get the most out of your health plan.
So a quick tip on health reimbursement accounts. HRAs are accounts that only Unity Healthcare, which is your employer, can contribute to. You cannot contribute to an HRA. You will automatically be placed in an HRA if you enroll in the high deductible health plan and you receive Medicare, TRICARE, veterans benefits in the last 3 months, or you're enrolled in a spouse's plan and they don't have a high deductible health plan. CareFirst has these wonderful tools and resources. One is called a treatment cost estimator, and one is a drug cost estimator. And these resources allow you to check in advance how much it's going to cost you to have a treatment or to pick up a specific drug. One of the great things about the drug cost estimator is that it tells you if there's a generic available and how much you would save if you chose the generic. One of the great things about the treatment cost estimator is that it gives you a list of averages of how much it would cost at different facilities closest to the zip code that you choose. These are great ways for you to have control over how you spend your HSA or your HRA dollars. So let's recap. The health savings account is available to employees enrolled in a qualified high deductible health plan. Both the employee and the employer may contribute to an HSA. These are pre-tax payroll deductions for the employee, and any employer contributions are not taxable. HSAs pay for eligible medical, dental, and vision expenses. Funds roll over from year to year, and they never expire. The account is owned by the employee. You can pay for your expenses with your HSA Blue Fund debit card. You can go online and click the Pay Now button at carefirst.com. You can have a check mailed to the provider, or you can reimburse yourself if you paid out of pocket because you didn't have your card. Let's look at the HRA. Still available only to those in the high deductible health plan, but in this case, only the employer can contribute to the HRA. Again, it still pays for eligible medical, dental, and vision expenses. The funds do roll over from year to year, so you can use funds from last year, next year, and so on and so forth. The HRA is owned by the employer. If you separate from Unity Healthcare, you have 90 days to submit any medical claims that you may have obtained while employed against your HRA balance. And it still pays for expenses with an eligible debit card through carefirst.com by pressing the Pay Now button, having a check mailed directly to the provider, or again, reimbursing yourself if you paid out of pocket. Additional resources, you can go to carefirst.com. Under the Blue Fund Administration link, you can view your HSA and HR balances online, any transactions or claims that you've paid, any contributions that you've made or your employer has made, and you can submit reimbursements for out-of-pocket payments. If you have issues or you may have lost your Blue Fund card, give them a call at 800-628-8549. Thank you for attending this presentation about health savings and health reimbursement accounts. If you have questions, please don't hesitate to email us at oe@unityhealthcare.org. Just a reminder, open enrollment ends on Sunday, November 20th. Don't let it miss you. Have a great day, guys.